drugs that can be continued on the day of the surgery. So to start off with questions, the first question is, can asthma medications be continued? Can it be continued or not? Next question is, what about NSAIDs? Can they be continued or not during surgery? Then we look at the psychiatric medications. So psychiatric medications, are they continued or not? So we'll find out these answers in this video. To start off with, the drugs which has to be continued on the day of surgery. So it is the antihypertensive. So antihypertensives can be continued on the day of surgery, and the exceptions are, there are some exceptions, that is the AC inhibitors as well as the ARB. Next we look at the cardiac medications. So cardiac medications also can be continued on the day of the surgery. And the examples being the beta blockers as well as the digoxin. Next class of drugs which can be continued include the antidepressant, the anxiolytics, as well as the other psychiatric medication. They all can be continued on the day of surgery. The other drug that can be continued is the thyroid medication. Next is, it can also continue the heartburn as well as the reflux medication. And also the eye drops can be continued on the day of surgery. Next, also in case of the narcotics, narcotic medications can be continued. That is the psychiatric medications. It can be continued. The anticonvulsants can also be continued. Then we look at the asthma medications. So in case of the asthma medication, it also can be continued. Next, looking at steroids. The steroids, it is also continued, that is the inhaled and oral. Then the statins, it can be continued. Also the levodopa, it is also continued. Lastly, the MAO inhibitors, it can also be continued, but there are some conditions where it can be continued. The first one being if the anesthetist approves it, and the second one is a possible of exacerbation or precipitation of the depressive syndrome. So in cases where the depressive syndromes, there's a possibility of it precipitating or exacerbating. So now we are going to find out the answers to our questions. So the first question was, what about the asthma medications? Are they continued or discontinued? So the asthma medications, can be continued on the day of surgery. Next, we asked if NSAIDs can be continued or discontinued. So the NSAIDs, they are discontinued, and as we saw in the other video, they are discontinued 48 hours prior to the surgery. That is 2 days prior to the surgery. Next question was, what about the psychiatric medications? So are the psychiatric medications continued or discontinued? So the answer here is, the psychiatric medications are continued on the day of the surgery.